Psychoanalysis starts with a focus on sexuality. Freud was very, some say now, sexually preoccupied. And psychoanalytic thinking has gone so far since Freud's time. And the emphasis on sexuality, interestingly, in many psychoanalytic schools of thought, has become diminished. That's one kind of fascinating thing about psychoanalysis, is that it starts with an emphasis and a focus on sexuality and moves toward the elaboration of things human that are not directly identifiable as sexual. And it depends on which school of thought that you're looking at, but one could argue that the relational tradition in psychoanalysis moves further away from an emphasis on sexuality than most contemporary psychoanalytic perspectives. It's an interesting twist. Like now, it's harder, or it's harder to talk about sexuality for some contemporary relational psychoanalysts, and it's not automatic. It's not like they're thinking we need to ultimately always get back to sexuality. Sometimes these days it's more like, no, it's about the relationship, the interaction, perhaps the enactment, but we could see that through a different lens, not necessarily a sexual one. So that's really like a fascinating thing to observe about the meanderings of psychoanalysis and psychoanalytic theory. One could attribute some of that perhaps to the feminist contribution, which says there's something very male about the way psychoanalysis is approaching sexuality, and almost some message like back off, like there are other ways of relating in the psychoanalytic situation or in relationships in general besides trying to move toward intercourse. And so there's this interesting pushback within psychoanalysis around how much genital sexuality ought to be emphasized and focused on. All that being said, I think it's really important for psychoanalysts to be very open to, aware of, sensitive to issues of sexuality as a central aspect of human experience that is always present in every relationship, in every moment. It imbues everything, and if we wish otherwise, we can wish that, but we can't change that. With the emphasis also in psychoanalysis on earliest experience and on the provision of caretaking in the mother-child relationship and in the analyst-analysand relationship, there's a kind of push to sanitize relationships, in a sense, making it about the provision of care, making it about caretaking rather than some more sexy aspect of the relationship that may be present. By thinking about the analyst as providing a maternal function and a caretaking or containing function, there tends to be a de-emphasis on sexuality per se. It's like just as the mother and baby may have quite a sexual relationship with each other, we also see that in the ordinarily socially acceptable world, the mother has to keep that sexual aspect to herself much of the time. And I think psychoanalysis follows suit in some respects and de-emphasizes the sexual, emphasizing the caretaking. And there may be some loss of sophistication of the analyst, loss of openness to what's actually going on in the analytic relationship because of that.